So this morning we're going to spend some time thinking about design, and we're going to do that in a couple different ways. So we're partly going to be thinking about the different components of your study and how you might collect those data and where you can find data. But then we might also spend some time thinking about proposals also, because how you phrase this and add this into your proposal can be kind of a whole nother beast, if you will. So we're going to start with an example, because I think it really helps to hear about a project kind of from start to finish, to hear about the program, the study that we did. I'll show you some findings, and then I'll dig into a little bit of the decision making that went into the study. You guys can ask questions. The paper that was published from this work, which we did with MDRC, I think that's available online. So it was published in DRE recently. So the program is called Reading Partners. And essentially it's a pull-out program, a supplemental reading program. And I'll share a little bit about that with you as we go forward. Let's see. Sorry. I had to do a Pechacucha talk recently. Do you guys know what that is? This is insanity. So it's like 20 slides for 20 seconds per each slide. You really can't have any words on any slides. And it's all got to be like your TED talk and all this. I don't know anyway. So my dean asked me to do this. And so I was like, sure, of course. Yes, I'll do this. Anyway, so some of my slides might accidentally have timers. But I'm going to try to catch it. Yeah, but it's online for your viewing pleasure. Nice little YouTube video. It's pretty embarrassing. Anyway. All right, so the policy problem. Reading. We've been working on reading for a long time. I feel like, you know, when we got started here, I was really shocked in hearing that 2/3 of American fourth graders are reading below grade level, and that about 1/3 of children in the nation lack even basic reading skills. Right? I was like, wow, wasn't this like the thing we did in the 90s? Like, how is this still? Oh my goodness. So we really had a policy problem that was set out for us. We knew that there were a variety of interventions that had been found to work, but some of them were really costly, right? So yesterday, Clive said a little bit about reading recovery. That's one that's really been found to have very sizable impacts, but it's also really resource intensive. So we're faced in a situation now where a lot of states and districts are working with a smaller budget than they were pre-recession. So we're really trying to figure out ways to provide services to students, to improve student outcomes, to reduce inequities within our school system, but we're doing that with fewer resources than we were before. So we need to find some better ways to get services to kids, and one might be through using volunteers. So this supplemental reading program, generally it targets grades K through 5. It's about a half a year to 2.5 years behind, children who are behind in their reading. They do need to be conversationally fluent in English, and this is not a program for students with sort of special education needs. So it's 45 minutes, 2 times weekly, and it's a one-on-one session where there's sort of 2 desks smashed together, where you have your volunteer tutor and you have your child. There's a packet, so it's sort of evidence-based and really highly guided, so that pretty much anyone can come in off the street, run this program with some support from the school site coordinator, and run this program. So when you look up the program online, there's 6 core components. There's this one-on-one tutoring. There's dedicated school space. So a classroom, generally a classroom, is provided for the program to operate. So this is like their reading resource center, reading center type room, where they set it up basically like a classroom, but they have the desks together and coupled so that the volunteers and the students can work together. They have the materials that the program brings in. It's this data-driven instruction, so as each volunteer works with each child, they fill out some forms. those data get added to the system, and then the next time the volunteer comes, everything is sort of ready for them to go. There's a lot of rigorous ongoing training. So Hank talked about this program a little bit yesterday, and that this is the program that involves AmeriCorps volunteers. So AmeriCorps volunteers work at the school site to oversee the reading program, and then those individuals are trained and supervised by the Reading Partners program. Okay, so basically, and these are all important aspects when you're thinking about the programs that you're evaluating. So when you start to think about your audience, or you think about who's your decision maker here. So for this type of program, for Reading Partners, it's a school level decision. So I knew right away I wanted to make sure that our analysis was relatable to a principal. Schools have to pay a fee for service. So I knew that there would be some transaction that we would have to take care of after documenting the ingredients. The school provides that space for the reading center, so there's going to be some costs to the school that are beyond that budget, right? There's going to be some ingredients at the school level that we want to think about. Then RP staff oversee the program. So yesterday we talked a little bit about this distinguishing line between administration and oversight and then the implementation at the school. So here I know that there's going to be some program staff who are involved in implementation at the school, so I know I'm going to need to think about their time. Then we have the AmeriCorps members. So then I also know that I need to understand that relationship between AmeriCorps and the program, and if there's any kind of transfer happening there. And then we've got the volunteer tutors from the community. Now, we talked a lot yesterday about theory of change. So here, if the volunteer is truly a key component of serving the child and sort of the go-between between the materials and the developed program and the child, I started to wonder if there might be any aspects about those volunteers that we might want to know about. And so I was curious to know, well, did volunteers vary in any kind of systematic way across sites with their qualifications? All right, so if you have one school site that's located in an area where everyone's sort of highly educated, coming in on their lunch break, that kind of thing, versus another school where maybe parents themselves are struggling to read a little bit, are we going to see differences in outcomes based on the skill levels of those volunteers, which I was using as a proxy of their degree or their job, so the information that we had about those volunteers. Okay, so the evaluation was done by MDRC. It was a social innovation fund initiative, which was done through the White House. And it was a scale-up of the program. So truly it was a question of, can we take this program to a larger scale across the country and see some positive impacts? And can we do that with fidelity? So we looked at impacts, implementation, and costs. It was a multi-site randomized design, which means that within each school, children were identified as being eligible for the program, and half of those students were assigned to the program, and half of them were not. So we had 19 school sites across the country, and then for the evaluation, we looked only at grades 2 through 5. So here are some important things to think about in your audience and in the way that you're disseminating your findings. So we're not just talking about Reading Partners as it was designed K to 5. Right now we're talking really specifically about grades 2 through 5. Then that also tells us too, when we think about the effect size of the program, when we see a smaller effect size, that makes sense because it's more difficult to move reading amongst 4th and 5th graders than it is to move it among kindergartners. So these are all comparative issues that you guys will think more about tomorrow when we think about cost effectiveness comparisons. But it's just one way where if you have an impact on reading in 5th grade and an impact on reading in kindergarten, those two things are truly not comparable because the effect sizes just by nature of growth over that time are going to be different. Okay, so this is not intended to be really legible, but the idea is that we looked at impacts, trying to see not only were there average impacts on sight word efficiency, reading fluency, and comprehension, but then we also wanted to see was there any variation there? Was there any heterogeneity? by grade level, gender, incoming ability, English language learner status. We also were in schools where they had previously had the program. So we also wanted to know if any students had had the program previously, so this would be secondly, like their additional dosage, right? Did those students do better? So then, as I mentioned, we were really curious about delivering it with fidelity at scale. And then with costs, we ended up with some questions about, what resources are needed to implement the program. So that's basically saying, what's our list of ingredients? What's the cost associated with that? And then of those, what portion was borne by the school? Right? So I mentioned that the principal to me was a really important audience member for this work. So I wanted to know specifically of the costs of this program, which ones are borne by the school. And so then also, because we're talking about students who are behind in reading and students who are required to receive supplemental support services by law, when those students who did not get randomly assigned into the treatment group, when they were in the control group, they were still going to receive supplemental support. So this is that fuzzy situation from yesterday where I know what the treatment is, but I'm not completely sure what business as usual is going to include. So we really wanted to be careful to think about what were the other supplemental support services being received, what kinds of resources were required to implement those programs. So what was this context like? Okay, so I'm just going to give you guys the findings first. We did find positive impacts, so this was great. We found positive, statistically significant impacts in comprehension, fluency, and sight word reading. It was about a month and a half of gain, so about a 0.1 standard deviation increase. We were really excited about this, and we really didn't find any heterogeneity. It seemed equally effective across groups. Oh, see, there's that timer. All right, maybe there will be another one. It was just on time, though. You guys wouldn't have even known. All right, so then for our cost portion of the study, so we outlined all of our ingredients here. And so basically what we talked about yesterday and what we'll focus on for the majority of today is basically this portion. So you have the reading partner staff, you have the AmeriCorps members, it's school staff time. So some school staff time is related to identifying the students who are eligible for the program, and then coming in and checking in, making sure the program is part of the school. And in some schools, they do more of that than others. But because we were looking at a site level, we were able to break that out by site, but then aggregate across for an average. Well, yeah?
But there's variability within sites. And we were kind of talking about that in our group yesterday, where some schools might use these materials or these personnel, and others might just try to get an average at each site, or really kind of break it down within site.
Okay, so just in case you guys didn't hear, and then also for the recording, I would say, okay, so you're asking what if there's variation within site, and how do we document that? Within a study where there's these multiple levels, I think you've got to decide at which level you can afford to study and at which level makes the most sense for your decision maker. And I would relate it to your theory of change and where you might expect variation that could be important. So in a classroom level study, so I'm currently working on an RCT where it's a classroom level, we have classroom level data. And so classrooms are randomly assigned within schools. And so I'm collecting treatment and control classroom level data within multiple classrooms within each school. And that was really driven by the fact that it's a curriculum, it's a classroom level program. Things are less likely to vary within the classroom, but they're likely to vary within the school. So I try to use those kinds of guiding principles of where I expect variation to occur and why, and then how that might be related to the generation of the outcome. Does that help?
Yeah, so I guess still at, like, let's say one classroom in the treatment group uses 3 teachers, and the next classroom in the treatment group uses 2 teachers.
Mm-hmm.
Are you averaging that out to get your
Okay, great question. Okay, so how are we averaging and how are we breaking that out? Okay, so I would say in your data, I try to have at that granular level as much as possible. So here is one classroom, there's 3 teachers. Each teacher has these qualifications. There are this many students, there are this many books, there's this many, whatever you need at the classroom level, and I try to have that as a distinct list for each classroom. But then to get to this, I average across. And I do that in a weighted way usually to adjust for like different sizes at different sites. But you can report that in different ways. So some this afternoon we'll go through some where the site level list is broken out. But here we didn't see a lot of variation at this point, but in the next slide I'll show you what it looks like across sites. Yeah.
When you were mentioning the characteristics of the volunteers and potential variation by wealthy or more educated, were you looking at that for the impact, on the impact side, or is that like the replication for the cost? I mean, you can't buy better volunteers, right? I mean, did you mention that to us because in terms of the impact, or is it?
That's a great question. That's a great question. So I was curious if there could be a difference in that resource. So in the qualities of the volunteers, the characteristics of the volunteers, if that might be related to a difference in outcomes.
So impact.
Well, it's a way of using a difference in resources to try to understand a difference in impact. Does that help?
Yeah, I was just wondering if
I wondered
if you were putting that into the ingredient.
Well, yes, and so part of the way that we did that is we factored in, so we're going to talk after this session about pricing. So when you price the different resources, you use the characteristics and the qualities of those different resources to pair an appropriate price with them. Volunteers is a particularly tricky one. Do we give them a minimum wage amount? Do we give them the wage for the type of job that they're performing, right? So in this case, it would be like a tutor or a teaching assistant or someone like that. Or do we assign a wage to them that's more close to the wage that they're giving up to be there? So in my work, I try, if I think that the education level of the volunteers could potentially be related in a systematic way to the outcome, then I'll use both. I'll use the price of a tutor or a teaching assistant, and I'll use the general like average wages based on their education levels, and I'll look to see if that looks any different. And in this case, surprisingly, it was not. Like really not at all. But then it worked out that we didn't really find any variation in our impacts anyway. But it was definitely something that I wanted to explore. So here it's where in your reporting, you'll only have a few tables. But in your data, you're going to have many different tables, many different analyses, many different things that you're exploring. And that may go into how you describe what you've done, and that may go into a footnote about some sensitivity test that you've done. And so for this particular report, I believe in it, it's more of like a footnote or a one-sentence kind of thing of, we did test the sensitivity of our results based on the valuation of volunteer time, and we didn't find a difference. We also included the volunteers' transportation. So to get that information, we asked the school site coordinators, who are your volunteers? Where were they coming from? What's commute, like what are commute times like there? Are these people who are walking from nearby, or are they taking some kind of public transportation? What does that cost? Or are these people driving? And so then we assigned some average transportation times to the volunteers at each site to try to come up with that estimate there. So for the facilities, it was the classroom, and then we had some materials and equipment. So then we come up with our total per student cost of about $36.10. But then we had that really important second question that we talked about yesterday, right? So how were these costs financed? Which was one of our main questions, right? Because I wanted to know specifically what was happening with the school. So here we have the school staff time, right? That's by the school. We have the facilities, the classroom, that's financed by the school. So then here we have $390. But we also know that there's a transfer because the school is providing a fee to the program to have the program there. And so here that's a transfer. So the school is paying Reading Partners, and that's helping Reading Partners to finance the ingredients that they're providing. So we'll go over this again in the afternoon so it has more time to sink in because this is a particularly new concept. But generally in the end, when we look at this after the ingredients that were financed and then any transfers, about 710 of the 300 of the 3,600 was provided by the school, or 20%.
Question, Brooke.
Yeah.
We're including transportation for volunteers. Is this between sites, or is this from their home to the volunteer site?
So here, we didn't have the opportunity to actually survey volunteers, but we did, in talking with that program coordinator person, ask where were people typically coming from, how far away was that, were they driving, walking, taking public transport. So if it's public transportation, it might be, $350 or whatever the metro may have been there.
So what's the reasoning on doing that for volunteers and not for your staff and so forth?
Well, so the volunteers this is part of what they are giving up and donating in a way to make the program work, whereas it's for a staff member, that's part of the job, right? So you would assume that would be captured in their pay. That would be somehow factored into their decision to take the job and to accept the pay at that wage. Okay. So as I mentioned, we were also really interested in what else was happening at the school. This is hard to read, I'm sorry. I'll just walk you through a little bit. So when we think about Reading Partners, right, we know that it's in this $3,600 range. So across sites we did have a little bit of variation, but not a ton. Largely that was related to staff time, so principal time, and then the space that was allocated to them. So some sites had larger spaces than others. But then we started looking at the other supplemental services, and generally on average those were about $1,780. So not as much staff time, not as much materials, not as much oversight or training, maybe not as much one-on-one time with kids. And largely here we were talking about small group supplemental support services. Some may use computers, some may be in a small group in an office or a small group in a classroom. But then where this really got interesting is when we started thinking about what were the costs borne by the school. So across the board, Reading Partners was anywhere from 15% to 26%. So on average, we get that 20% of the costs were borne by the school. But for the other supplemental services, it was nearly 100%. Because there we're talking about a program that the school is buying, that the school is implementing, an additional staff member that the school is employing. So this really became a really important story when we started thinking about Reading Partners and we started thinking about the fact that it works. And then when we put it in context, the amount that the school is funding, or the amount of the costs that are being financed by the school, it truly makes this seem like a great deal for the school, that they get a resource-rich intervention without having to pay for all of the costs that are related. Sorry. Yeah.
So for the Reading Partners, is that on soft money that's going to go away, whereas the supplemental looks like it's not? So what I'm interested in is if it's just grant funded for a couple of years versus when it goes away, it seems like the costs are going to be very different. And you're kind of comparing apples to oranges.
This is a good question. So here we're factoring in the transfer as though the schools were buying the program. We're not counting it as an MDRC purchased program for the grant for the evaluation. And so that way we were truly looking at it as a cost to the school for that replication scale-up type purpose. And for the others, you know, and the schools, I mean, schools generally, I did not go in and ask the schools, did you seek out any additional funding, or how did you internally finance this based on your district resources and whatnot? I didn't ask those questions. So that could be in any number of ways. It's going to make us wait. Sorry. All right. So we worked in close collaboration with MDRC. We went through the ingredients method with them. We worked closely with the program itself. We went through program materials, the program's theory of action. We went through evaluation design documents, because in those design documents and in that process, you have a sense of how is this program going to be implemented, how is implementation likely to vary, how do we think outcomes are being produced, what are the important resources in that production, and how might those resources vary within our study. So then we took that initial step to draft an initial ingredients list, and this is generally, I'm just going to wait. This is generally where I start every time, is I try to get some sense of the program, but because I'm a visual person, I need to get it down on paper. So I just start making that ingredients list. So just exactly what you guys did yesterday, I sit around either with myself or with my team and just start making that list. What all's here? What am I missing? And then I take that list back to the program. And then I work through it. So this is this person, this is their role, these are their responsibilities. You know, am I missing anything here? Oh, there's a book challenge with rewards and stars and stickers, and oh, okay, great, let's add those in. So that conversation can be a really helpful one. We looked at data collection tools and the timeline for data collection so that we could try to build in the cost study into those tools. We wanted to utilize the existing data that were being collected as much as possible. So in this situation, we were not collaborating with MDRC at the design phase. And so we were coming in later, as implementation was already ongoing, to try to build in a cost study, to add the cost study into the study, into the evaluation. So this meant that we knew generally a lot of the data that were available to us, but it also meant that a lot of the data collection tools had already been set. So we weren't really able to add certain questions or lists of things for the observation checklist. We weren't able to go in and do as much observation as we would typically do in a study. But we were able to rely on their data. But going forward, I do this a little bit differently, where I work the cost study actually into like every component that I can going in and in the design phase and in the proposal phase, so that it truly adds only as much as is absolutely necessary to the study and utilizes the data that are there. All right, so we also reviewed lots of options for the cost study and what we could do and what kinds of questions we could answer. And based on a budget, we were only able to go into a few sites. We weren't able to go into all the sites, which you may have noticed from the table earlier. And that was difficult. You know, of course we want to go into all the sites, and of course we want to interview all the people. But that wouldn't work. And so we said, okay, well, so what's the question we really want to answer here? We really want to know, because we're looking at a scale-up and we want to know about implementation fidelity, we want to know for sites who really had strong implementation fidelity and who represent variation in geographic location, and who have staff who can talk to us because the cost study was happening at the end of the year. That's how we were going to select our sites for the cost study. So we knew going in that there could be some mismatch between our cost study sample, so our subsample, and the larger sample, which I think may be this slide. And so we knew right away, like there could be some issues in the end of putting costs with effects, so we knew we were not necessarily going to ever build a ratio with these two numbers. But we did want to get a really good sense of what are the resources that go into doing this well. So when you set out your research questions, if you're forced to look at a certain sample, that might be something that you consider. Do I want to have an average cost estimate that's going to correspond to my average effectiveness estimate? And then I need to make sure that any sampling I do corresponds to that.
Will you say that again, please?
Yeah. So I'm saying if, but what I really should be saying is you should, in designing your studies, try to make sure that you can estimate an average cost that's representative of the sample in the same way that the effectiveness estimate is representative of the sample, so that those two numbers can go together in a ratio. Essentially, what's happened with this is that because we can't put them into a ratio, now I'm trying to figure out funding and an approach so that I can use like a missing data imputation type approach to try to predict costs for the sites where we have data but no cost data, so that then we could maybe see what the average cost would be that would correspond to the effectiveness estimates that we did get. That's not necessarily a situation that anybody should be in, right? Like I think if we can design it such that we can get some cost data from all sites, or if we randomly select sites, or if we're careful to select sites that represent a diverse range of sites that we would think would be representative of the sample, there's any number of ways to go about doing that. I'll also say, just because I'm thinking about it, as you guys go forward and do this, let me know what's happening with your sampling and what kinds of decisions you're making and how that's working for you. It's something that I'm particularly interested in, and I've been trying to put together sort of a research agenda to think about this aspect of the method. How we're sampling, do we have to sample? Where are we sampling and in what ways? How does that limit the kinds of questions that we can answer, or how does it help us to answer the right questions? Dan, did you have a question?
Well, I mean, I was just wondering if you ever end up putting confidence intervals on cost?
Yeah.
Okay.
You can do that. Clive, I'm nearly positive tomorrow goes into that with cost effectiveness. And if not tomorrow, then in his uncertainty sections, which will happen Friday, I think.
Okay, great.
But later this afternoon, I'll show you some results from the talent search program that I mentioned yesterday. And in that, we were able to do some Monte Carlo simulations and some bootstrapping kinds of things, so we could think about, what would some confidence intervals be. And there, that works. It's easier to do some of that when we have more data. So when we aren't using samples, when we're truly using our whole, we're not using a subset of our sample, we're using our whole sample. So I've really been putting a lot of effort into trying to simplify the design process and simplify the data collection process so we don't have these sampling problems. So that's kind of my goal. We'll see. Okay, so as I mentioned, I knew that we'd be interested in some supplemental questions. Right? So we always start out with what's the total cost and what's the cost per student. It's just where you always start. And I highly recommend in most of your first times, most of your first studies in doing this, focus on those questions. Because it gets kind of overwhelming to think about all the other questions that you can ask. But we'll review some over the course of today so you have some sense of what you might be able to do. But here I knew variation in costs among site was going to be something that might be interesting. This who finances the costs. And then we were also curious about this. So what happens if the treatment group receives reading partners and the control group receives all these other supplemental services? Is there really a difference in costs? So here it seemed like we should also be really considerate about a net cost estimate. Now, this is where our sampling also became interesting. In the sites where we were looking at costs, we didn't find that there was really any difference in the other supplemental services that students were receiving. And so by that I mean that the treatment group and the control group they were all receiving a lot of other supplemental services. And so reading partners in those schools truly was an add-on. So we could just look at the cost. We didn't net out any costs of the control group. However, we know over the whole sample that this is not the case. We know over the course of the whole sample that the control group, or our non-program group, that they received more other supplemental support services. And so a net cost estimate there would be really important. All right, is that making sense to everybody? Any questions? Yes?
I'm just thinking about, from a school's perspective, they might want to know how much am I spending on reading support for my students? And in that case, if the treatment group is getting, you know, the intervention plus these other supports, and I want to think about the cost to support this child in their reading, I mean, that's a whole different way of thinking about it. And then, of course, you have the control group, so that, you know, maybe it's not net, you know, there's a net, maybe no net difference, but it's still a useful number from the school's perspective.
Absolutely. And I think that that's an important context. It's a way that your resource lens can provide an important context to what's happening in each group, that what the students are receiving, so that it isn't really treatment versus nothing. It really is treatment plus school plus other services compared to other services plus school. And so it helps me every time to draw out also in this kind of scenario, to draw out basically what we looked at yesterday, where it's like you've got like your, you know that both of them have school, but then there's a question of like other. Okay, so then you've got, I don't know if you guys over there can see this at all. Can you? Okay. So then there's just a question of like, are these two things equal? Or is it like this? Does other come up here? So essentially, or are these kids also receiving less down here of other? And then it's RP here. And then are they possibly receiving less resources, right? So any combination of things could be happening at this point. I mean, we're almost expecting that if a child gets assigned to reading partners and a child gets assigned to the control group, that then the child in the control group is going to get assigned to other services. And so then when we found that it was actually much more messy than that, that was kind of an interesting thing to learn. And so now, going forward, I try to think about that and to incorporate that in a way that I hadn't really done previously, where I ask questions about, well, what are the other supplemental services provided? So like, for example, with the randomized control trial that I mentioned earlier, it's a reading curriculum, and so a reading curriculum is replacing the reading curriculum in the classroom, but there are lots of other supplemental programs being used within the classroom. So then that's a question for both treatment and control conditions. But then there's a whole other question of what about other supplemental reading support, like pull-out for kids who are struggling in the classroom. And so now I notice to come in asking questions about that context when I know that we're talking about something like reading. Whereas on Thursday morning, we're going to do a cost effectiveness exercise of a really fun robotics program. That's likely being compared to not much of anything else, right? So you've got to really understand that context and what is business as usual in a way that includes the resources. Okay, so we were able to use most of the data that MDRC collected through interviews and surveys, and they had some management information system data. They really had a lot of rich data for us to use. So we only had to do a few interviews, but we create research protocols to do that, and we do interviews in an iterative way. That's not something that you all have to adopt, but that's just kind of what we've done historically. We try to make it conversational. Generally, answering questions about the size of a room or people's qualifications or how many hours people have spent on certain tasks is not a very fun conversation to have. So we try to make it more fun. We try to make it approachable. I generally tell the story about my grandma's cookies. You know, like I try to make sure that these people see us as people and not like what Hank mentioned with like, you know, John with the visor and he's in the background. You know, we want people to talk to us and tell us their stories. This is something that has to go through IRB. So remember that, especially if you're adding on towards the end. Make sure it gets through IRB. Usually it's expedited or exempt, but that is something that we have to think about. And then data storage. So I was talking with some of you guys yesterday about data storage can sometimes be a main factor in how you think about collecting your data and how you think about the questions that you might want to answer in the end or the tables that you might want to present. So if you have nested data, you've got to think carefully about, well, at what level am I storing the data? Am I using Excel or am I using Stata? And how am I going to do that? So that might be something that you start thinking about from the beginning with your team. Okay, so that's it for the example. You guys have any other questions about reading partners? For now, if not, that's okay. The PDF is online. You can take a look at it. I'm here all week. I'm happy to answer any questions about it or any other work that's available out there. Okay, this slide is mostly for your review because it's pretty small. But it's just like any other research that you're designing and you're thinking about. You start with the problem, the need, your audience. You think about the program, the theory of change, you set out a logic model. You determine which impacts are going to be measured and how. You establish that framework, which includes your cost study. And it includes some kind of consideration of that evaluation context. In your research questions, think about the questions that you might include for the costs. You'll set out the scope, your data collection plan, and then any other sort of important aspects to note, right? So with the Reading Partners example, I was really curious about this other supplemental services issue, right? And so you would start to make those notes in the beginning. This is going to be something we want to look at. We want to carefully measure control. We might want to even do a quick survey of volunteers about their qualifications and their travel time, right? So if you think about those things in advance, you can have the data to work with later. Whereas if you don't have those things built into your data collection plan, you can't. You're stuck with answering questions that you can answer instead of answering the questions that you want to answer. Okay, so there's a lot of different questions you could potentially answer here. Most of these I think we covered already. Scale. Okay, so with the Reading Partners, we did actually look at scale. So some sites had closer to full capacity, whereas other sites, they were really underutilizing the amount of space and number of desks and number of staff. So when you have a program where you have sort of high fixed costs, you have staff, you have a classroom, you have materials, and it's all sort of set up for a certain number of students. When you serve fewer than that, your cost per student is going to rise, just by nature of the fraction. And so here you might have a question of, well, if everyone were working at scale, how would the cost per student look? How much would it change? Is this something where sites should really be carefully considering their investment in this program, but then also considering the number of students that they would have to fill the seats? So then there's other programs where a lot of the costs are really highly variable. And so that's where, so usually tutoring programs can fit into this, where you have like a one-on-one type service. So for each additional child, you have additional costs. Really good other examples are like a mobile dentist type program or like a psychological services, where for each child who needs a psychological assessment, there is a person who has to come and do that. And so those are areas where your scale and your fixed and varied costs can be kind of interesting there. And so mostly some of this is going to be here for your review, just so you can go back and have like a cheat sheet, if you will, right? I want to set out that ingredients list, review the data collection tools, think about any protocols that you might need to develop. All right. Yes.
That's it. One question before the worksheet.
Yeah.
Going back to thinking about effectiveness, I think you said the effect size was 0.1, right? So that's relatively small effect size, I guess, depending on which grade level you're looking at. You mentioned the kind of natural growth in reading in upper grade levels is smaller than they are for lower grade levels. So I'm just wondering how you talked about like the effectiveness of this program with regard to those kinds of, with that relatively small effect size. Or do you put that in context and say this is more meaningful, this is the bigger effect if we're considering it among 5th graders versus considering it among 2nd and 3rd graders?
Yeah, so we talked about all of it, honestly. We talked about the fact that we were very excited and how it's not common to find statistically significant positive impacts on reading amongst 4th and 5th graders. So we were really excited, even though it's a small gain, we were really excited to find a gain. Then we didn't really see any distinction across grade levels, so we did see that it was positive gains across all of them. But we were, this is not a program where our findings suggest that this is the only thing, right? So, I mean, kids are still receiving reading in the classroom. Kids are still, building that whole portfolio of reading services. So the way that I talked about it, because of this cost effectiveness option, is that it seems like a really good option that could go into your menu of services. But where it really is distinct is that you wouldn't compare reading partners as a pull-out program from this evaluation amongst 2nd through 5th graders to reading recovery, which was like a 1st grade evaluation, and their impacts were like a 1 standard deviation increase. And so there you have this like larger context. And so when we start to think about comparisons and investments and menus of programs, I think that's where my job as a researcher is to be as clear as possible about what I've done and how that fits in with the other work that I know exists. But where I think another next step that could be really quite interesting is thinking about how those decision makers, so how a principal then uses that information to try to build the best menu of services for their students at their school. And so that's something that I think that there's definitely room to learn more about and to work on more with. But basically in our reporting, we just tried to be really clear, but we were really excited. And so we shared both of those, being really transparent, but also being really excited about the findings. Yeah.
I'm thinking about sort of the staffing and planning these studies, and it sounds like you play a pretty big role, hands-on, and sounds doing at least all of the interviews of the coordinators, but I'm wondering how many other staff, at least in this kind of planning phase, how many other staff did you have involved? And kind of, sort of an estimate of how much time you think this part all took you.
Yeah, no, that's a great question. It depends on the study. For a retrospective study, so where like an impact estimate already exists and you're going to go back and most of your data will come largely from interviews, and then you'll have data that can come from like evaluation, MIS type data, information from the evaluators themselves about the sites and who was involved and their decisions. In those, some of the interviews may take anywhere from 45 minutes to like 2 hours plus, because you're working with very little information. And so part of our push for having the cost component integrated into a study going prospectively is to try to cut down on those costs. There's just no reason for us to need to have like many 2+ hour interviews with individuals when we can collect those data going forward in a really simple way. So, for example, with the RCT that I'm working on of the reading curriculum, I am leading the cost study portion. So I'm the person at the table with the statistician and the PI and the fidelity person. So we all work together as a team, start to finish. But then we have a team of people who are collecting data that include RAs, so graduate students, and like a program assistant type person. And then we ourselves are also doing some of the data collection. And we're all just doing that together. Where some of it can get tricky with the timeline is when you start thinking about the desk work that you need to do after you get those data back. So when you go through the pricing with Robin a little bit and you think through analyses in the afternoon and we work through cost out, you can start thinking more about, well, what would I need to do after I've done the IRB and after I've done my observations and my surveys and then added any, like, you know, maybe I'm talking like 1 or 2 questions to an interview, maybe 4 or 5 questions to a survey, which are likely going to be asked in some way anyway, but this way they have a slightly more a more resource-based focus. So once you get those data back, then you have to make sure that you have time to then pull the data, start working with your data, price your data. And that may be something that you can have someone spend a couple hours on so they can go use the cost tool that you'll learn about this afternoon, pull prices. Then you might, you know, if you're working in Stata, you might create variables for your prices. Then you create a new variable multiplying the price by the quantity. You'd want some time for sensitivity analyses at that point. So there would be some extra time built in at those points. Dan.
So you mentioned like surveys using existing MIS systems and other interviews. Do you ever ask staff at the site to like track their time on a spreadsheet or anything that detailed, like how much time you're spending on the project?
It varies on what we're doing. Some of you guys got to meet Fiona at dinner last night, and she's worked a lot on the cost tool that you'll learn about this afternoon. She did a study of MOOCs where she worked with some faculty who were providing MOOCs to take a time log, a very intensive time log of like numbers of minutes each day spent on different types of tasks. That is the most detailed data collection that I think I know of. In the study that I'm currently doing, we did do a teacher time log, which was something that they had planned on doing anyway. So it's basically something that goes out a few times over the course of the year. A teacher gets it, she can do it on her phone or on any kind of device, and just over the course of the day asks her what she's done for every 15 minutes. She can fill it out as the day goes on, or she can take notes. And then that gives me information about the amount of time she's spending on prep. That gives me information on the amount of time she's spending on teaching. Was there any kind of shifting in the amount of time she spent on teaching for this particular subject versus the control group? And how are we going to account for that? Rob.
I can share just one more example, sort of broadly speaking, that I think is illustrative. In part, it's a little bit unusual, but I think and it has some advantages and disadvantages. But a study I'm working on right now with Viviana Matzko is part of, so there's a cost study that was part of an entire evaluation framework that was developed in advance of everything else. And I think that, first of all, was really helpful, that evaluation framework, and sort of really thinking about how all the different pieces of the design fit together. The thing that is not so helpful is that the evaluation framework really has 3 components. There's an implementation analysis, a cost analysis, and then an impact evaluation that are happening in that order, which first of all, I think it would be better if all 3 were happening concurrently. Secondly, I think that order is a little peculiar. But it is really helpful that the implementation analysis happened and was really detailed, including some time logs, and including, there's a lot of graduate students that are involved in this program. We have access to like their actual like time sheets, and so there's a really rich amount of information we had as a starting point, and that really helped inform the cost analysis so that it could be pretty efficient. The data collection there was pretty sort of light touch. So we were able, first of all, to do a cost analysis for a fairly low cost to the program, and not just in terms of our time at the center, but also not really disrupting the schools so much. So we were able to just kind of quickly kind of have a phone call or an email with a couple of follow-up questions and say, well, we got all of this information from the implementation analysis, and we just need these 3 additional bits of data to do the cost analysis. And then the impact evaluation is not happening yet, but it's under design. And again, it would be better if it were concurrent, but at least the fact that it's being designed, then we're getting a better sense of what the counterfactual is, and what comparisons are, and what business as usual looks like. So it's not optimal, but I think that that kind of design and being part of a larger framework and the different pieces of an evaluation speaking to one another can really help make the whole process more efficient.
Okay, so I'd love for you guys to take a few minutes to go back to your groups from yesterday. Look at the ingredients list that you all had started to set out, and then think, for each ingredient, what questions you might need to ask to get the data that you need for those ingredients. Where might you find those data? Would that be something that you might be able to ask in an interview, or would that be a question that you could ask on a survey? Maybe this is something that if you did a teacher time log, it would be there. Maybe this is in your MIS data. Maybe you could get this information from the program, right? There are lots of different ways that you can get the data that you need without adding to this burden that we place on teachers already by being in their classrooms, adding to the situation there. So if you guys would take a few minutes and do that, then we'll report back.